Ever get hooked up to one of those echocardiograms? It's always kind of weird experience. Like the lights go down, they're moving that wand thing all over,
Mhm.
and all those weird sounds. Makes you wonder what they're really looking at, right?
Oh, it's a fascinating process for sure, and way more intricate than people realize.
And that is what we are diving into today, folks. Echocardiography. Using sound waves to actually see the heart in action. Pretty amazing stuff. But we're not just skimming the surface here. Oh no. We're going deep today thanks to some seriously in-depth guidelines from the American Society of Echocardiography. They literally wrote the book on this stuff.
These guidelines are really the gold standard. It makes sure that every echocardiogram, whether it's done in a small clinic or a big hospital, is held to the highest possible standard for quality and accuracy, of course.
Because a blurry picture of your heart isn't going to be very helpful, is it?
Not helpful at all. No, these guidelines are all about making sure every single detail is crystal clear. And that allows those cardiologists to make the most accurate diagnoses possible.
You know, one thing that really struck me going through these guidelines, I mean, so much goes into getting those crystal clear images. I always figured it was just, having a fancy machine and pointing it in the right direction.
Oh, it's much more nuanced than that. Much more. Just for starters, the sonographer that's the expert operating the machine, they have to consider the patient's body habitus.
Body habitus. Is that
Yeah.
like a technical term for
I'm not.
body type?
Precisely. You see, ultrasound waves, they don't exactly travel through every body type with the same ease. So, a larger physique, well, that might require some tweaking of the machine's settings just to make sure those sound waves can really penetrate and give us those clear images.
So, not a one-size-fits-all approach at all.
Not at all. The sonographer, they're like a technician and an artist all rolled into one, constantly adjusting settings, choosing the right transducer.
The one.
That's the one. And they have to manipulate it so precisely to capture the perfect view.
Speaking of manipulating the transducer, it's always kind of funny watching them move it around. It's like they're trying to find the perfect angle for a selfie. But instead of a phone, they've got this high-tech wand thing.
And let me tell you, every little movement, whether it's tilting, sweeping, rocking, angling, it's all done with a purpose. Each one designed to capture a specific view of the heart, like puzzle pieces. And they all fit together to form a complete picture of how that heart is structured and how well it's functioning.
Okay, so let's talk about those puzzle pieces. What are some of the must-get stops on this little echocardiographic tour of the heart?
Well, first off, we've got the parasternal views. Those are taken from beside the breastbone. And they give a great view of the heart's chambers and valves from a few different angles, too.
So, like, if the heart was a house, this would be like looking through the windows on the side.
Perfect analogy. Then you've got your apical views, taken from the tip of the heart. Gives you a view from the bottom up.
Ah, so we've moved from the side windows to peering in the basement window. And what about these subcostal views I keep hearing about?
Now, for the subcostal view, picture this.
Yeah.
We're going off-roading. Forget the windows. We're finding a way to peek underneath the house.
Okay, now you've got my attention.
So we carefully position the transducer below the rib cage, giving us a view from below the heart. Especially helpful for seeing the inferior vena cava.
The what a cava?
The inferior vena cava, it's a major vein, carries blood back to the heart.
So like the heart's plumbing system, but we're seeing it from a whole new angle.
You got it. And even within each of these main views, there are tons of specific positions and angles the sonographer uses, trying to capture that heart in all its glory, you could say, like a whole series of snapshots that, when you put them all together, they reveal this amazing dynamic beating organ.
It really is amazing how much detail they can capture. I remember seeing an echocardiogram image once. It was like looking at a live anatomical drawing. Is there like a single most important view? The one they always make sure to get?
Well, it's not really about one single most important view. It's more like a collection of essential views that, when you put them all together, give a comprehensive assessment of the heart structure and function. But if we had to pick a greatest hit, it'd probably be the PLAX view.
PLAX view. Catchy. What's so special about it?
Well, the PLX view, short for parasternal long axis, it basically gives us a lengthwise slice of the heart. Like, imagine cutting it open from top to bottom. It's really important for measuring the left ventricle.
The what now?
The left ventricle, the heart's main pumping chamber.
Ah, so now we're getting into the nitty-gritty, huh? The measurements that tell us how well the heart's actually working.
Exactly. We can see the thickness of the heart walls, how big the chambers are, even assess how well the heart is contracting and relaxing. But as good as these still images are, what if we could add in movement and sound?
That's where Doppler ultrasound comes in, right?
Mhm.
Where things get colorful, literally,
Yeah,
and we get those cool whooshing
you
sounds.
got it. Doppler ultrasound takes us way beyond those static images. Now we can actually visualize and measure the blood flow through the heart. It's like switching from black and white photos to a high-definition, full-color movie.
So we're not just seeing the heart structure anymore, but we're actually seeing the blood flow in real time. Wild.
Exactly, and not just seeing it, but hearing it. That distinctive whooshing sound you hear during an echocardiogram, that's literally the sound of your blood moving through your heart valves.
No way, that's amazing. And I'm guessing those colors that show up, those aren't just for looks, are they?
You're right, those colors are packed with information. We call that color Doppler. It uses shades of red and blue, even green and yellow sometimes, to show us the speed and direction of blood flow.
So not quite as straightforward as red means danger, like in the movies.
Haha, not quite, but you're not totally off base. In general, red means blood is flowing towards the transducer, and blue means it's flowing away. Brighter the color, the faster the flow.
Okay, I think I'm following. So a bright red jet would mean blood is moving quickly towards the transducer. What would that tell us about how the heart's working?
Now that's where the real detective work comes in. Let's say we see that bright red jet shooting through a valve that should be closed. That could point to a leak, what we call valve regurgitation, where blood flows backward.
Oh, so that's how they can actually see those leaky valves we talked about.
Exactly. And then we have spectral Doppler, which takes things even further. It generates those graphs, the ones with the whooshing sounds, and those give us really precise measurements of blood flow velocity. We can see how fast the blood is moving, in what direction, and even if there are any turbulent flow patterns.
So it's like going from a basic visual map to a super detailed report, all thanks to the power of sound waves. That's pretty remarkable.
A great way to put it. And all of this information, the still images, the color flow patterns, those velocity measurements, it all helps cardiologists figure out one crucial thing: the heart's ejection fraction.
Ejection fraction, right, I've heard that before. It's basically how much blood the heart pumps out with each beat.
That's it. Think of it like the heart's efficiency rating. A healthy heart will pump out, on average, about 55 to 70% of the blood in its left ventricle with every beat.
So if someone has a lower ejection fraction, that means their heart isn't pumping as well as it should.
You got it. And that could signal a problem with the heart muscle itself, like heart failure. That's when the heart struggles to keep up with the body's demand for oxygen and nutrients.
This is all making so much more sense now. I can see how echocardiography helps diagnose all those different heart conditions we hear about. But it's not just about spotting problems, right? It's also about making really accurate measurements.
Absolutely. Remember those super precise images and Doppler readings we were talking about? Those become even more important when we start taking exact measurements.
So, time to break out those virtual calipers and start measuring the size of those heart chambers.
You got it. And we're not just talking about the overall heart size here. We're looking at the thickness of the walls, the diameter of the valves, the volume of blood in each chamber, all those tiny details. They can make a huge difference when it comes to diagnosis and treatment.
Give us an example. What's one of those key measurements that can tell us a lot about how healthy a heart is?
Let's go back to that PLAX view, that lengthwise slice of the heart. From that view, we can carefully measure the thickness of the left ventricular wall, both when it's relaxed and when it's contracted.
So it's not just how thick the wall is, but also how much it changes during each beat.
Exactly. If that wall is thicker than it should be, especially if it's not relaxing properly, it could indicate a condition called hypertrophy. That's where the heart muscle has to work extra hard to pump blood, often because of things like high blood pressure or problems with the valves.
It's really incredible how such tiny differences in measurements can tell us so much about what's going on inside the heart.
It really is. And those precise measurements, those help cardiologists go beyond just making a diagnosis. They can actually track how well treatments are working over time. By comparing echocardiograms taken months, even years apart, they can see if the treatments are doing their job and make adjustments if they need to.
Wow, so it's like charting the heart's progress, how it adapts and changes over time.
Exactly. And this brings us to a really important aspect of echocardiography that I think often gets overlooked. It's not just about finding problems. A lot of times, it's about providing reassurance.
Reassurance? How so?
Well, imagine a patient comes in with chest pain, maybe some shortness of breath, and they're worried they might be having a heart attack. An echocardiogram can quickly tell us if their heart muscle is healthy and pumping the way it should be.
So it's a huge relief for those who don't actually need invasive procedures or intense treatments?
Exactly. It can really help calm someone's fears and give them peace of mind knowing their heart is doing what it's supposed to do.
That's a really good point. It's easy to get caught up in all the technical stuff and forget that behind every echocardiogram, there's a real person with their own worries and anxieties.
Absolutely. And that's why clear communication between the patient and their healthcare team is so important. The more patients understand about echocardiography, why it's being done, what it can tell us, what the results mean, the more empowered they are in managing their own health.
It's about moving away from that old doctor knows best approach and towards a true partnership in healthcare.
Exactly. And honestly, that's one of the reasons I think these deep dives we do are so crucial. They help close that knowledge gap between medical professionals and the public, and that creates a foundation for better understanding and more informed decisions.
Well said. So we've explored different types of echocardiography, from those highly detailed still images to the amazing world of Doppler ultrasound, and we've seen how those precise measurements can really paint a detailed picture of the heart's structure and how well it's functioning. But it seems like echocardiography is always advancing. What are some of the developments on the horizon that have you excited about the future?
Oh, there are so many exciting things happening right now. But one that I find particularly fascinating is the evolution of three-dimensional echocardiography. We'll call it 3D echo for short.
3D echo, okay, now we're talking. So instead of those flat images, it's like
Yep.
almost holographic.
Exactly. Imagine being able to take a virtual model of the heart, rotate it however you want, zoom in on specific parts from any angle. You could even virtually slice it open to see all the internal structures in amazing detail. That's the promise of 3D echo.
That sounds seriously futuristic. How do they even do that? Is it a special kind of transducer?
Some systems do use a special transducer, yeah. It automatically sweeps across the chest to capture all those different angles. But others use really advanced software to kind of reconstruct a 3D image from a bunch of 2D images taken with a regular transducer.
Oh, so they're like stitching together a bunch of high-res snapshots to create a full 3D model.
Precisely. And the detail is incredible. You can see individual chambers, the valves, even those tiny papillary muscles that control the valve,
Oh,
all with amazing clarity.
that's wild. But like, besides just looking really cool, what are the real benefits of 3D echo over the traditional kind?
One of the biggest advantages is accuracy. Because you're seeing the whole heart, the measurements are much more precise, especially for things like those chamber volumes and ejection fraction we were talking about. That's crucial for figuring out how serious a condition is and how to treat it best.
So it's not just about a fancy image. It can actually lead to better care and outcomes for patients.
Absolutely. And for some of those more complicated cases, like when there are issues with the heart valves, 3D echo gives you a level of detail you just can't get with 2D imaging. That's so valuable for planning those intricate surgeries or minimally invasive procedures.
Wow, it sounds like we're on the verge of a whole new era in heart imaging. But like any technology, I'm guessing there are still some limitations with 3D echo.
Of course, it's a powerful tool, no doubt, but not a magic bullet. It still relies on sound waves, so things like body habitus, remember we talked about that, or even other medical devices. Those can sometimes interfere with getting those super clear images.
And I'm guessing it's probably a lot more expensive than the regular echo.
Yeah, that's true. 3D echo does cost more, and it's not as widely available yet, but as technology keeps improving and those costs come down, I think we're going to see it become a lot more common.
It's pretty exciting to think about what the future holds, but before we get ahead of ourselves, let's bring it back down to earth for a minute. If someone's about to have their first echocardiogram, what's the one thing you really want them to take away from all this?
I'd say the most important thing is to remember. Echocardiography, whether it's 2D, 3D, or whatever amazing advancements come next. It's a really safe, it's painless, and it is incredibly informative for understanding your heart health.
So no need to be nervous or scared about the process?
Not at all. It's painless, it's non-invasive, and it's giving you and your doctor crucial information about one of the most important organs in your body.
That's reassuring to hear. This deep dive has been truly fascinating. We've covered so much ground, from how those sound waves work to seeing the intricate details of how the heart functions, and we even got a glimpse into the future of cardiac imaging. It's pretty mind-blowing.
It's been a pleasure joining you today. Always great to talk about something so important.
And for our listeners, we hope you've gained a new appreciation for this incredible technology. And of course, for the skilled professionals who use it every day to help keep our hearts beating strong. Until next time, keep exploring, keep learning, and most importantly, keep those hearts healthy.